Hello everyone, welcome to your spine. Today's episode of At Home Training with Ryan and Theresa is going to focus on a little bit of education and also nerve flossing. But I just wanted to be able to show you a physical representation of what I'm talking about today. So this is your spine and your nerve rope, which is the combination of your spinal cord and your nerves and your nerve roots, run in this space. I don't know if you can see, the top of my chopstick is following along. These little holes that are behind the vertebral body, but in front of the spinous process, is where your spinal cord lives. And you can see a top to bottom view here, which is called your vertebral foramen. Now, different types of vertebrae have different spaces, but I won't get too complicated in my explanation. Just know that what we're doing today is teaching your nerves to move through this space freely. Now, your nerves, in order to be healthy, also need mobility. Just like the rest of your body, your nerves like movement. So I'm going to show you some nerve flossing techniques that you can use for full body, but that also help to relieve a little bit of sciatic pain. Now, I am not a specialist in this category, so if you have any numbness or tingling sensations or pain while doing this, I would advise you to see a doctor or a physician or a physical therapist or anybody in the health industry that could be of service to you, because what I tell you here is in no way a medical substitution for diagnosis. Thank you, Ryan. So I'm going to show you a technique whereby you can create tension in your nerve rope on one end of your spine and then release on the opposite end. So when I sit in a chair, there's an easy way to do this. If I extend my leg and pull my toes back towards my shin, I feel automatically a little bit of tension that runs from my knee to my hip. Now that could be perceived as hamstring tightness, but oftentimes it's actually the nerve, the femoral nerve that runs through that area that is actually tight. So what I can do in order to create release on this nerve from the top end is tilt my head into a backward position. So I have freed up a little bit of the tension in my nerve rope, and I've tightened tension here in my nerve rope. Now, if I go ahead and bring my upper body into a neutral position, or my neck or my cervical spine into a neutral position, and I then flex at the knee and bring my head down towards my chest, I'm now stretching the nerve root up, superior to my hip. And I'm releasing that tension via my knee extension. Now, you don't have to understand all the science to this, but you would come through a few repetitions of flexing the toe, extending the knee, and lifting the chin up to the ceiling, and then coming back through, bringing the knee into a flex position, and the same with your neck. Coming up and down, maybe 5 or 6 times, should help to move the nerve through that foramen that exists in your spinal column and help just translate that through to your exercises in your day-to-day activity, really. Now, you can do this in a laying position as well. So I'll just show you an alternative. You would lift your leg up and flex your toes towards your shins, and you can go ahead and extend the toes, lifting the head, and flex the toes, lowering back down. Doing that slowly, maybe 5 to 10 times, is a great way to give your nerves some mobility practice. Let us know how you go. leave us some questions in the comments if you have any.